Scroll Toyota, leading the way every day. And Scroll Toyota, symbols of trust.
Bill 20 would implement a 4% fee to insurance companies on Guam to be used for the GMH Healthcare Trust and Development Fund, a fund that would help the hospital to pay off its vendors. The authors of the bill argue that because of qualifying certificates or tax breaks these health insurance providers have been receiving for years, the premiums for health care insurance are tax-free. Therefore, they believe that this 4% fee would not burden these companies. Guam Memorial Hospital Administrator Joseph Verga testified in favor of the bill, saying that the hospital is in a very precarious financial position, making it impossible to stay current with its vendors.
Because of the debt of the hospital, we are on a we have a very small credit limit, especially from preferred vendors where we receive services and critical supplies at the most cost-effective rate. We're also in debt to a group of 20 or more physicians that have received that provide services at the hospital. Many physicians have not been paid for a very long time.
In fact, vendors came forward and testified in favor of the bill as well.
For several years, I have been on house call in the hospital, and there have been an accumulation of services that have been unpaid for the past several years. And so I really appreciate Senator Rodriguez. He's trying to address this problem of debt by the hospital.
I must say that in the more than 25 years that I have directly managed our small family-owned business, I have seen our accounts receivable from GMH grow from $50,000 way back in 1987 to more than $1.2 million presently.
However, health insurance provider Calvo Select Care testified in opposition to the measure, saying they would have no choice but to pass on this 4% fee to its customers. In other words, that it would have to raise its rates for health insurance.
The 4% that is in the language of the bill, what would it do to the insurance companies? And you probably not a question for you. Maybe Frank or someone can answer the question. What would it do to the insurance companies if they did not pass on that 4% to the consumer?
I think it will discourage insurance companies from doing business on Guam. Simple as that.
Campillo says that because of health care reform, health insurance companies can only retain 15% of the money they collect for administrative services and profits.
It's very difficult, and it will be extremely difficult for any company to operate on an 11%.
Campillo suggested instead that the hospital improve its collections from self-pay patients and from Medicaid and Medicare.